Welcome to Helget Gas Products CGMP training for drivers. In this module, we will take a look at the law, the regulations, and some of the guidelines applicable to Helget Gas Products drivers that are filling and distributing medical gases. Information for these sections can be found in Chapter 21 of the CFR, that's Code of Federal Regulations, Parts 210 and 211. Some of the topics to be reviewed are a brief overview of the Food, Drug, and Cosmetic Act, the misbranded and adulterated drugs, and what constitutes a misbranded or adulterated drug, some of the prohibited acts, and some of the regulatory action and penalties for doing prohibited acts. We'll also take a detailed look at the CGMPs and their applicability to Helget Gas Products drivers. Again, the CGMP is current good manufacturing practice. The regulations are found in Chapter 21 of the CFR, Parts 210 and 211. There are also numerous guidance documents that the Food and Drug Administration uses as they do their inspections and investigations. Labels and labeling. Although not specifically addressed in sections 210 and 211, they are addressed in other areas of the Act, specifically 201. There are some definitions that you need to be acquainted with. For example, a label. A label is a display of written, printed, or graphic matter upon the immediate container of any drug. As an example, think of your labels that are on your oxygen USP cylinders, your nitrogen NF cylinders, or your nitrous oxide USP cylinders. That is your drug label. Now, labeling is all the other labels, written, printed, or graphic matter that are placed upon any drug or its containers or wrappers or accompanying any drug. Gets a little confusing here, but think of it in this manner. Under labeling, our lot code label is labeling. Many times a DME company will put their own label on the cylinder, which assists them in recovering cylinders when more than one vendor is taking care of a rest home or hospital or a patient at their home. When it says accompanying a drug, think of it in this manner. If you go to a pharmacy and you get your prescription and it comes in a small bottle, a lot of times you will receive in the sack written instructions that can't possibly be put on that bottle, or the bottle would be 4 feet thick. So that is an example of labeling. What would constitute a misbranded drug? If your labeling is false or misleading. Give you an idea about false or misleading. If a cylinder is filled below its settled pressure, but the lot code and the liters that are displayed on that lot code show it to be, say, 680 liters, which is what is in our E's. An E is supposed to be at 2000 psi at 70 degrees. But if that E is only at 1900 psi at 70 degrees, but the liter content still shows 680 liters, that's an example of misbranded. The labeling is false. There are not 680 liters in that cylinder at 1900 psi at 70 degrees. Labeling can also be misleading if it purports to do something that it can't do or has not been proven that it can do. Think of your dietary supplements, how they guarantee you're going to lose 50 pounds in 5 weeks and not do any exercise. If it hasn't been proven that that dietary supplement will actually help your body to lose that 50 pounds, that's a misleading statement. That makes that drug misbranded. If your labeling is missing the required information. Now, labeling and labels. Remember, labeling is the additional material that's placed upon the drug or drug container. The label itself has to have the complete name and address of the manufacturer of that drug. It also has to have a statement of the net quantity of contents. For example, liters on your cylinders or standard cubic feet, or in the case of liquid cylinders like your D55 oxygen, for example, the pounds that are in that cylinder. If your label is not legible or obliterated, that's a cause of misbranded drugs. Now, what do I mean when I say it's not legible, not readable, or it's obliterated? If there is any portion of the legend that is on your label that cannot be read, whether it's the precautionary statement or the UN number or whatever it happens to be, if any portion of that label is not legible or not readable or has become obliterated, that's misbranded. So as a driver, you have to make sure that when you are loading your cylinders on your truck, that you take a look at the labels and make sure that they're not rubbing against one another. Because just that action of rubbing labels, two cylinders rubbing labels together, will cause the labels to become obliterated. They won't be legible. You can't read them, so we can't deliver them. It becomes a misbranded drug. This is an example of the current nitrogen NF refrigerated liquid label. If you'll notice down in the bottom right hand, it has Helget Gas Products Inc. and our corporate address. It also has the complete legend. If you will also notice, there is a statement RX only. It is just above the Helget Gas Products logo on the bottom. This makes this label a medical label. It states up on top nitrogen NF, and it states down on the bottom RX only. This is an example of the oxygen for a refrigerated unit, D55. If you'll notice, it also says oxygen refrigerated liquid USP. If you go down towards the bottom, right under the warning, it says RX only. That's your medical label. Now, why do I spend time looking at labels? In our business, there are times when we will have industrial cylinders and we will have medical cylinders on the trucks for deliveries. We need to ensure that only medical product is delivered to only medical customers. That's why we need to be sure that we understand and can recognize medical labels. What constitutes an adulterated drug? Remember, we've already had misbranded. Now we're going to look at adulterated. If it consists of any filthy, putrid, or decomposed substance. We don't have to worry too much about our decomposed substance because we're dealing with a gas. If you were dealing with a pharmaceutical, then that becomes extremely important. All of our cylinders need to be clean. They don't need to have any grease or oil, tape, anything of this nature on them. If it has been prepared, packed, or held whereby it may have been contaminated with filth or have been rendered injurious to health, that would constitute an adulterated drug. If the methods used in its manufacture do not conform to current good manufacturing practices. The current good manufacturing practices for our industry are very specific in what needs to be done in a step-by-step manner. You will understand this a little bit more as you spend some time in a warehouse that manufactures a medical drug gas. You'll also understand this a little bit more when you start filling liquid oxygen dewars or liquid nitrogen dewars. What are some of the prohibited acts that are applicable to HGP drivers? Altering the labeling, whether it's part or in whole, which causes misbranding or adulteration. When you alter a label, you may change some of the information on that label. If you change the information on a label, that would cause that drug product to be misbranded and or adulterated. Now, how could you do that? Well, there are some companies that put out their products that have an expiration date on them. Expiration dates are not required on medical drug gases, but some companies have decided to put them on there. You need to deliver, for example, a lung diffusion gas to one of your customers. And you happen to notice that, oh my gosh, the expiration date was last month. So you take out your little razor knife and you cut that expiration date out. That is altering the label, and that does cause it to be misbranded or adulterated. In that particular case, it would be both. Misbranding is a misleading product or misleading statement. Adulteration is changing your label. Delivering or receiving for delivery adulterated or misbranded products. Again, if you were working in the warehouse or you are assigned to pick up some medical drug gas products from one of our vendors, and you do not take a look at the labels that are on those cylinders to ensure that they are totally legible, everything is appropriate, that would be a prohibited act. If you accept product that does not meet our standards and the FDA standards, that's a prohibited act. Some of the regulatory actions and penalties, you must remember that your vehicle is an extension of the warehouse. As such, you are also subject to an investigation or inspection while you might be on your route. To begin with, they would show you what they call a 482. Now, what that is that is their authority to investigate. They'll look at anything that they absolutely want to, including your delivery tickets, including your cylinders that are on the truck. If they find any issues, they can do a report of observations, which is what they call a Form 483. As a company, we will respond to each and every 483 with our corrective actions. There could be, if they deem the observation serious enough, there could be a warning letter that would be written giving the company 15 days to correct or develop corrective actions that meet the FDA guidelines to correct any of the objectionable observations that they've noted. You could end up, or we as a company could end up, in a regulatory meeting where we actually sit down with the FDA and discuss what needs to be done. The FDA can also do what they call a seizure. They can seize all the drug product that has been manufactured and hold it. They can do an injunction, which will force you to do what is right, or if you don't want to do what is right as a company, they will force you basically out of business. It can get a lot worse. That's just some of the things that could happen. We don't want it to happen. That's why we go through our training sessions. Titles 21, Parts 210 and 211 contain the minimum current good manufacturing practice for methods to be used in and the facilities are controlled to be used for the manufacture, processing, packing, or holding of a drug. The purpose of the CGMPs, current good manufacturing practices, is to assure that a drug meets the requirements of the Act as to the safety of the drug and has the identity and strength and meets the quality and purity characteristics that it purports or is represented to possess. Failure to comply with the minimum CGMP, current good manufacturing practices, renders the drug to be adulterated, and the drug as well as the person who is responsible for the failure to comply with the CGMP regulations shall be subject to regulatory action. Notice it says shall be, it does not say may be. The Food and Drug Administration is very serious when it comes to ensuring the safety and the health of the patients that are taking the drugs that we are manufacturing, the same as they do with any pharmaceutical company. In the subparts of CFR 211, Chapter 21, there are a number of general provisions. It also deals with the organization and the personnel. It deals with buildings and facilities, which includes the trucks. It deals with the equipment, not only of the manufacturer, but it deals with the equipment as far as the testing, whether you're using a Servomex or a Maxo or any other piece of equipment to check the assay of oxygen or nitrogen. It also deals with the control of components, containers, and closures. For example, on your trucks, you are supposed to have your industrial cylinders separated from your medical cylinders. It's called segregation. In the warehouses, they have to have their cylinders segregated. Fulls from empties, industrial from medical, and customer owned from company owned. It also deals with the production and the process controls, how we produce it and how we control it. It deals with packaging and label control. Label control, for example, if you're going out to make a delivery to a home care company that has just put in some new oxygen reservoirs, you will need to sign out liquid oxygen labels, the medical liquid oxygen labels. There is a specific sheet that is used. You sign the labels out. You document what you've used on your delivery ticket, and you return any unused labels at the end of your day. Holding and distribution. As you're loading your cylinders on your trucks, in the warehouse there are designated areas that deal with hold for review, quarantine, full released. You cannot take any cylinders out of the hold for review area until those cylinders have been reviewed and released. It also deals with laboratory controls. Laboratory controls are the items, again, that you use to test the assay of oxygen reservoirs. It deals with records and reports. Records, delivery records. Who did you deliver to and what did you deliver? We put down our serial numbers on the doers, the serial numbers on the oxygen reservoirs. We record all the significant steps of production, and that delivery ticket is reviewed and released at the end of the day. Some of the reports that we may have are customer complaints. That is a customer complaint report. If a customer complains about a medical product, you as the driver are required to initiate the complaint form. You should have a complaint form in your manual, or in your binder, excuse me, that is in your truck. Complete the complaint form as accurately and as completely as you possibly can, and make sure that the cylinder is designated as a complaint cylinder so that when you return to the branch, you can get a QCU member, you can show them the cylinder, they can quarantine the cylinder, and you can hand them the customer complaint form for their investigation. Returned and salvaged drug products. As a medical gas facility, we do not have products that are returned. Any cylinder that has left our control and gone to A customer's location, whether it be a rest home, a hospital, a DME, or a patient's home, even though they may not have used it, even though the little white tab is still on there, that cylinder, if you pick it up, is considered empty. We do not have returned drug products. Think of it in this manner. You go to your pharmacy, you get a prescription, and you take it home. And you decide, I really don't want to take those pills. They're big enough to choke a horse. I'm going to return them. The pharmacy will not take them back because that has left their control. So there is no returned full medical cylinders. (211) also deals with the organization and the personnel. You have to have the appropriate organization and you have to have the appropriate personnel to satisfy the current good manufacturing practices. Under the organization and personnel, you have what they call a quality control unit member, QCU. That quality control unit member is the person that is going to review the production records, release the product so that you can load your truck and deliver the product. Some of the responsibilities include the standard operating procedures, SOPs, some of the specifications, deals with a record review, again that is your review and release, deals with testing of products, and the responsibility of a QCU member is also to approve or reject product. If a medical drug product does not meet our specifications or does not meet current good manufacturing practices, it is the responsibility and the duty of a QCU member to reject that product. Give you an example. You have an oxygen line and there is a set procedure to filling cylinders. And a QCU member notices that the processor that is doing the filling skipped a step. It's a significant step of manufacture. And not blatantly, but he did skip a step. For example, you may have skipped the evacuation step. It is the responsibility of the QCU member to reject that rack, make the processor blow the cylinders down, evacuate them, and refill them. Personnel qualifications, education and experience. The training, job function specific, hands-on training. The training in the standard operating procedures where you will actually sit down and read the sections of the manual that are pertinent to your job. The whole manual is pertinent to the company. But there are some things as a driver you're not going to be doing. You may not be filling oxygen cylinders on the rack. So you don't really need to know everything there is to know about filling the oxygen cylinders on a rack. But you do need to know everything there is to know about filling liquid oxygen reservoirs at a DME or patient's location. You do need to have current good manufacturing practice training. Training frequency. There are guidance documents out there that give an area of training frequency. How often should you be retrained? We review our current good manufacturing practices on an annual basis. All the QCU members get together via teleconference and we go over any changes that may have happened since the previous year. From that point, the QCU members will pass on that information to all the processors and drivers so that they are current. There is a documentation of the education, training, and experience. The Food and Drug Administration looks at it like this. If it is not written, it did not happen. You may be the best driver in the world. You may not have any issues with any of your delivery tickets. But if your training file does not show that you have gotten the training on the SOPs and the current good manufacturing practices, then the Food and Drug Administration could come back and say that the products that you manufactured, i.e. the liquid nitrogen dewars you filled or the oxygen reservoirs you filled, are adulterated because you do not have the training documented. There are additional personnel requirements in 21 CFR 205.7 that do not pertain to you at this time. Personnel responsibilities, clothing, sanitation habits, health conditions. Clothing. We want to ensure that our personnel represents themselves and the company in the best light. You don't want to be delivering products with grease stains, oil stains on your jeans or your uniform. Sanitation habits, washing your hands, covering your mouth when you cough. Health conditions. You don't want to be delivering medical gas products with open sores or lesions on your arms or hands. Color blindness. Color blindness pertains to the manufacturing of cylinder gases. In the FDA and the CGA, Compressed Gas Association, they have come up with a color scheme for medical gases. Green is oxygen, brown is helium, black is nitrogen, blue is nitrous oxide, and gray is carbon dioxide. Now, if you are a manufacturer of one of those products and you have say a green-brown color blindness, you would look at a cylinder and it might be green or it might be brown, but you can't tell because you're brown-green colorblind. You couldn't manufacture medical gas products. Limited access areas, that deals with areas like the quarantine, the full and released, the hold for review. Those are limited access. Quarantine areas are limited. Some of the buildings and facilities, well, you notice I've got a picture of a truck there. The truck is an extension of the warehouse. Therefore, it falls under the Food and Drug Administration current good manufacturing practices. Design and construction features applies to both buildings and vehicles. Is the truck suitable to facilitate maintenance and proper operations? Are you organized? Do you have all your medical cylinders separated from all of your industrial cylinders? All your empties separated from your fulls? This is the adequate space to prevent mix-ups and contamination. It's also defined areas to prevent contamination and mix-ups, delivering empties instead of full cylinders. Lighting. Do you have adequate lighting? Can you see what you're trying to do? Maintenance. Is your vehicle in a good state of repair? Does it need repairs? Not only does it fall under the DOT requirements, but if you have a box truck and the box truck has numerous holes, and those numerous holes will allow dirt, debris, rain, snow, whatever, to fall upon your medical products, then that's not maintained in a good state of repair. There are additional facility requirements, and there are additional security requirements and storage requirements. Some of the equipment that we use. If you notice, you have your thermometer. That's used when you are filling oxygen reservoirs. Oxygen and medical clean. Some of our branches deal with devices, CPAPs, BiPAPs, oxygen reservoirs for rent. They need to be clean before we deliver them, and they need to be maintained in a clean area. Our equipment has dedicated connections. All your cylinder valves are specific to the gases, with very few exceptions. One of the exceptions is a CGA 580 valve. The CGA 580 valve can be found in nitrogen NF, nitrogen industrial, beer gas, argon, helium. The oxygen, however, and the nitrogen post, the nitrous oxide, and the carbon dioxide are all specific to that gas. We want to make sure that our hoses are protected from the environment. If you have a nitrogen hose to transfer liquid nitrogen from your D55 into a dewar, you should have a plug so that when you are done filling the dewar, you could put the plug on the end of the fill hose to ensure that no dirt or grease or other contaminants get into the fill hose. Same thing should be said for oxygen when you're filling your reservoir. Safety relief devices when you're filling an oxygen reservoir, depending on the manufacturer and the type of reservoir, you may have some very low pressure and some medium pressure. All of your cylinders have safety relief devices. Your liquid cylinders have safety relief devices. Counteracting the safety relief device is not only a violation of DOT and a violation of the Food and Drug Act, it is also a safety hazard. Putting the wrong safety on the wrong cylinder could cause catastrophic events. The equipment construction, surfaces that contact the product shall not be reactive, additive, or absorptive. When we are filling liquid oxygen reservoirs or liquid nitrogen dewars, we want to make sure that where we are filling them, it is clean and free of any grease, oil, or other contaminants. Lubricants or coolants shall not come in contact with medical gas products. To give you an example, oxygen, for example. If you look at your triangle of fire, you need three elements to cause a fire. You need a fuel of some kind, you need an oxidizer of some kind, and you need an ignition source. Lubricants, by their very nature, are petroleum-based products. Very, very few lubricants are oxygen compatible. Coolants are petroleum-based products. So there is your fuel, your first item, a lubricant, petroleum product. Oxidizer, well, you're filling a liquid oxygen reservoir. So if you're not diligent in making sure that where you're filling that reservoir is free of contaminants, you may have 2 out of 3 in the triangle of fire. The third is an ignition source. An ignition source does not have to be an open flame. An ignition source could be something as simple as static electricity, as simple as a heavy footstep on liquid oxygen. The compression of your footstep on liquid oxygen could cause a reaction. It could cause an explosion, or it could even cause a fire. That's why lubricants are not allowed around liquid or gaseous oxygen or any other medical gas product. Under section 211.67, it deals with the cleaning and the maintenance. Cleaning and maintenance of not only the equipment that we use to fill, but the cleaning and maintenance of the reservoirs or dewars. It deals with the responsibilities. Who is responsible for doing it? It deals with the schedules. How often are we required to maintain that piece of equipment? It deals with the methods and the equipment and materials that are used to clean and maintain that equipment. It deals with protection of clean equipment prior to use. If you remember back earlier, I had mentioned that some of our branches deal in CPAPs, BiPAPs, rental reservoirs. When a piece of equipment is cleaned, it needs to be, for lack of a better term, bagged and tagged and kept in a nice clean area so that when we have to deliver that piece of equipment, the patient or the nursing home, wherever we're delivering it to, receives a piece of equipment that is clean and ready to use. It deals with the inspection of the equipment immediately before use. We refer back to our delivery tickets. Whether you're filling a liquid oxygen reservoir or a nitrogen dewar, there are specific steps that need to be taken. You inspect the equipment prior to fill to make sure that that piece of equipment will not only accept the fill, but is acceptable to use. For example, if you were doing a liquid oxygen fill and you noticed that where the liquid oxygen fill hose attaches to the reservoir, there was dirt, grime, or grease, you need to contact your QCU member who will give you directions as to how to proceed. In many cases, we are the third party that is filling for somebody else. another DME company has the business and we are filling for them. In that particular case, the QCU member will get a hold of the DME company, DME standing for Durable Medical Equipment, get a hold of the DME company and tell them that we are unable to fill that specific reservoir because of its contamination. For our hoses, we need to not only keep a maintenance log on all of our equipment, whether it be our trucks or our filling equipment, uh, manifolds, yokes, cold ends, bulk tanks, etc. We need to keep those in a maintenance record file. Again, refer back to an earlier statement that I made where the FDA views it if it is not written, it did not happen. So we can have very, very clean equipment, very clean hoses. But if they review our maintenance logs, our maintenance records, and find that there has been nothing documented as to maybe a replacement hose because the hose that was on the truck after a year or however long became leaking, if it's not documented, it didn't happen. And because it didn't happen in the FDA's eyes, the product that you are filling has now become adulterated because we are not following current good manufacturing practices. Control of the components, the containers, and their closures. Components is your supply gas. For a truck, that is the liquid oxygen D55 or liquid nitrogen D55 that you happen to be using. There's a written procedure for the supply gases which shall be followed. They need to be stored to prevent contamination. They have a supply lot or batch numbering system, and it is identified as to its status. Now that pretty well those requirements are pretty well for the manufacturing end, the branch, if you will. However, this does not exempt you as a driver or your truck, which is an extension of the warehouse. We have written procedures for your supply gas, your D55, or your analytical gases to calibrate your servomix. The supply lot and batch numbering system, the lot number, for example, the lot number is your total history of the manufacturer of that product. Supply lot identified as to its status, whether it is quarantined, released, or hold for review. That's what they're talking about when they say supply lot identified. On your truck, everything is identified as being released. All your full product on your truck is released, provided you did not take it out of a quarantine hold for review pile. Receipt and storage of untested components. As a driver, you won't have any untested components. In the warehouse, they may have. For example, when they receive a bulk fill, whether it be oxygen or nitrogen, or in Kansas City's case, nitrous oxide. The testing and approval or rejection of the components, this is where it hits your drivers. Examine visually for appropriate label. Make sure that your liquid oxygen or liquid nitrogen has a certificate of analysis on it. Make sure that you do not take anything out until it has been tested and released by a QCU member. Certificates of analysis. The certificate of analysis on your liquid oxygen and liquid nitrogen vessel has our name and address on it. It has the name of the product, for an example, nitrogen NF, nitrous oxide USP, or oxygen USP. It has a lot number. It has the actual analytical results for identity and assay. And if there are any other required tests, then those are also listed. On our COA tags, it has the test method used for analysis. What analyzer was used? Was it a Servomex? Was it a Maxo? Was it a Galmac? What was used? And then finally, it has to have a dated signature of the person doing the testing. Containers and closures. Cryogenic cylinders and their piping, valves, transfer hoses, and fittings. The home units and their piping, valves, and fittings. And the liquid nitrogen dewars. There are the general requirements, and there are written procedures which we will follow for the handling, the sampling, the testing, and approval or rejection of containers and closures. There are written requirements for the handling and storage to prevent contamination. And we have written procedures for our lot number and lot number configuration, and the codes for the containers and closures when that is appropriate. The testing and approval or rejection of the containers and closures, again, as a driver, when you are in the process of filling a liquid nitrogen dewar or a liquid oxygen reservoir, one of the first things you will do is you will do a visual inspection. If you find that you cannot fill that because the vessel that you're trying to fill has maybe a gouge, a large dent, um, dirt, grease, or any other contaminant, you contact your QCU member. Rejected containers and closures, by rule, they are withheld or quarantined from use until they are released by a QCU unit member. I cannot stress this enough. You cannot take product off of the production floor that has not been reviewed and released and put in its appropriate designated area. You do the examination for any contaminants. We do have written procedures to test for the conformance of the product. Any rejected containers need to be marked as quarantine rejected. And it would be nice to put a reason on there. If you are at a home care customer location, be it a rest home or a patient's home, and because of the inspection that you did on that container, you deemed you could not safely fill it, leave the DME a note as to why. Also, contact your QCU member so the QCU member can contact the DME and let them replace the unit. Drug product containers and closures, they must be non-reactive. They cannot react to anything. Non-additive, they cannot add anything. Non-absorptive, they cannot absorb stuff. To alter the safety, the identity, the strength, the quality, or the purity of the drug product. When you're in process of filling a liquid oxygen reservoir or a liquid nitrogen dewar, one of the things that you want to do is you want to purge your hose. By purging your hose, you just open up very carefully, you open up the liquid oxygen valve on the supply vessel and let a flow of gas go through your hose. That's after you remove the plug. Prior to doing that, please inspect your hose for any contamination. The laboratory and controls for containers and closures, there are some general requirements as to the specifications, the sampling plans, the test methods and procedures, all of which are in writing and all of which need to be scientifically sound, appropriate, and approved. And the sampling plans must be representative, 100%. When you are filling liquid oxygen reservoirs, each liquid oxygen reservoir that you fill will be sampled, will be tested. That is 100% inspection. On the production floor in the warehouse, one cylinder from each lot produced is representative of that lot. That cylinder goes through a few different tests, specifically the sniff test to see if there's any odor, and the assay. If that cylinder fails, it becomes what we call an out-of-spec procedure, at which time the QCU member will get involved. And there is a procedure to determine whether or not the analytical equipment was out of calibration or that particular lot failed. One cylinder represents the whole lot. If that one cylinder fails, that whole lot fails. Needs to be blown down, re-evacuated, and refilled. Some of our container records that we have. Records of incoming inspection. Document the cryogenic container pre-fill inspection. Again, refer back to your delivery tickets. There is a pre-fill inspection that you will do prior to the filling of that cryogenic vessel, whether it be a liquid nitrogen dewar or an oxygen reservoir. We do not have it right now, but it may be coming. Document the hose inspection and the purge. We do not have that on our delivery tickets at this time, but that will be an item that we will be incorporating in the future. There are potential new requirements for liquid vessels. One of them is they're dedicated to medical service. We want to ensure that medical oxygen D55s, medical nitrogen D55s stay in the medical service. We do not want to go back and forth between medical and industrial. You could end up with contamination because industrial liquid oxygens are many times used in the torching operation where they're using a fuel gas like a propane or an acetylene, and there could be backflow into the D55 of oxygen, causing it to be contaminated. There's additional labeling that we do. We do a 360-degree wrap. It is ID colored and printed background. Green for oxygen, it says medical oxygen. Black for nitrogen, it says medical nitrogen. And blue for nitrous oxide, it says medical nitrous oxide. The connections, the valves need to be silver brazed to the D55, whether it be oxygen, nitrogen, or nitrous oxide. When we look at the permanent integral part of the valve, what they're talking about is they are talking about the outlet of that valve. Not too long ago, what the DOT and the FDA wanted was they wanted that outlet silver brazed to the valve. They have since changed their mind on that, and they require now the use of tamper-proof devices. Tamper-proof devices are designed to thwart people from changing fittings from one gas to another. There are numerous examples, and some of them are very catastrophic. They've been very deadly. There are numerous examples where a maintenance person or a driver couldn't get a vessel to hook up to a manifold, so he took the fittings off of the empty vessel, swapped them out with the full vessel, and hooked the full vessel up to the manifold. What happened was the driver inadvertently delivered nitrogen to an oxygen facility. Numerous people became ill, a few died. That's why the use of tamper-proof devices is a requirement. We have our packaging and label control. There's a lot number identification on all high pressure cylinders. There is a lot number identification on all cryogenic containers. There is also a lot number identification on all of our oxygen reservoirs and nitrogen dewars. Remember I said earlier, the lot number is a code for the total history of the manufacturer of that drug product. Through the lot code, we can take and learn who filled the cylinders, what day they filled the cylinder. We can go back to the manufacturer and get their records as to when they manufactured that liquid bulk product and what the assay results were for that liquid bulk product. Lot numbers are also required to identify medical gas products in the event of a recall. We can go back through history, through our production records, and through our delivery tickets and find out who received any of the affected cylinders and issue a recall to recover those cylinders. That's why it is extremely important for you as a driver to not take shortcuts when you are delivering multiple racks of cylinders, multiple carts. You might have a 60-cylinder cart and a 24-cylinder cart and a 40-cylinder cart. Well, that's 124 cylinders. They can't all be the same lot code. Many of our branches can fill 72 cylinders on a rack of small cylinders. Many of them can fill 24 large cylinders or ego cylinders, go valve cylinders. So if you're coming up with 88 cylinders of the same lot, it's impossible. It can't be done. So make sure that your lot codes are accurate on your delivery tickets. production and process controls. This is a uh, copy of a delivery ticket. I just kind of dummied it up so you could see exactly what needed to be put where. If you look, you'll see Dewar serial number. This happens to be for a liquid nitrogen cylinder, Dewar. We assign the serial numbers to the Dewars. Many of the Dewars that are purchased today do not have serial numbers on them, so we assign the serial number. If you look at the lot code, our configuration for our lot code shows the first digits, 4 digits, are your truck number. The next digit is your branch number. In this case, it's a 2. The next 2 digits, 15 in this case, are the year of the manufacturer. The next 3 digits are the reverse Julian date. The next digit is the supply batch lot number. That was the first, in this case it's a 1, that was the first cylinder, supply cylinder, D55 if you will, that was filled on the 79th day of 2015. The last digit represents how many fills have been taken out of that supply vessel. In this particular case, this particular delivery, this is the 5th fill that has been taken out of that particular supply vessel. We do our pre-fill inspections. As you notice, we look at the Dewar itself and we check it off. We look to see if it has a withdrawal device. Some do, some don't. Some have a floating cap. Others will have an actual device that allows the technician that is using the liquid nitrogen to actually pour into a smaller container from a larger container. If there is a withdrawal device, you would put a check mark. If there is not, you would put NA. You want to check your label and make sure that it is totally legible. It is not obliterated. If you use any new labels, indicate it in the label number of labels used. In this particular case, there was none used. Because we do not test our liquid nitrogen Dewars, we refer back to the COA that is on the supply vessel itself. That's where you get your assay. In this particular case, it was 99.99. We also look for the lack of CO, carbon monoxide, in parts per million. We do not test for CO, carbon monoxide, other than on the incoming bulk batch that we receive from our vendor into our bulk tank. In this particular case, you would put in A. The filler, you'll put your name or initials and the date that you filled that particular Dewar. Down on the bottom it says liters filled. You'll put 35 or 30 or 20 or 5, whatever the number is of the vessel that you just filled. When you return from your route, your QCU member will review your documentation. He will sign off and date. Notice in this particular case that the date of release is 1 day after the date of fill. We have in our manual that that is perfectly appropriate. The next delivery ticket that I wanted to show you was a representation of a liquid oxygen reservoir fill. Now, as you can see, it asks for a reservoir serial number. In this particular case, we do not assign serial numbers because all of the liquid oxygen reservoirs have their own assigned serial number at the time of manufacture of that reservoir. Again, we have our lot number. It is the same configuration. The truck with a dash, then a branch, the year, the reverse Julian date, the number that the liquid oxygen supply vessel represents. This particular case, it was the second one filled on the 79th day of 2015. And the last digit represents the number of fills off of that supply vessel. In this particular case, this reservoir is the second fill off of the supply vessel. We have our pre-fill inspections, which is the vessel itself. You're looking for contaminations, dents, gouges. The outlet connection, you're going to check your outlet connection and make sure that it is clean. Make sure your contents gauge works. You look at the label and make sure that it's not obliterated. It's easy to read. If you used a new label, you'll document it here. You will document your pressure that's on the reservoir and the flow. I refer you back to your standard operating procedures. There is an operating procedure that goes through step by step exactly how to fill a liquid oxygen reservoir. This is just an overview. Then you have the post-fill, and it will put down tested by. What that is asking is, how did you test that liquid oxygen reservoir? You either tested it with a Max O2 or with a Servomex. Depending on how you tested it, that's the information you're going to enter. In this particular case, this unit was tested with a Servomex model 570. Servomex model also had a serial number, S is in Sam 203. We document the liters filled. In this particular case, there were 41. We do an odor test, and we had none detected. Because we identified, or because we tested with the Servomex 570, so long as we are above 99% assay, then the identity is okay, because the Servomex is an oxygen-specific analytical piece of equipment. You'll document your initials and the date you did the fill. You'll turn your ticket in, and either that night or the next day, the QCU member will release the ticket. Policies and procedures. Thou shalt, and here's how. Production and process controls. There are written procedures. If there are any deviations, those would be written as to how to handle them. The standard operating procedures are approved and they are followed. They're approved by the Quality Control Committee. They're approved by the QCU members, and they're implemented. Work is documented as it is performed. Notice, if you'll remember back on your liquid oxygen and liquid nitrogen delivery tickets, they are in a certain order, how they are supposed to be filled out. That order is specific, and that's how it needs to be accomplished. Step by step, document it as you perform it. Any changes or deviations from the standard operating procedures need to be approved prior to their implementation. You may think you have a better way of doing something, but a lot of thought has gone into writing the manual. So if you have a better way of doing something, present that to your QCU member, who will present it to the control committee, quality control committee. And if it is better, it will be implemented. If it does not meet the requirements that we have, hopefully that information is sent back down to you so that you can understand why it wasn't approved. Not that, well, I gave a good idea and they just ignored it. We don't ignore ideas. There is a master production and control records, preparation and approval, and review of all the SOPs, and that's to assure uniformity. People in Kansas City are doing the same thing as the people in Chicago, that are doing the same thing as the people in Omaha, on and on and on and on. We want to make sure everybody is doing the same thing. That way, one branch is not being a rogue and trying to do something differently, causing the whole company to come under scrutiny from the Food and Drug Administration. Container content, we want to assure 100% of the labeled amount. Way back at the very beginning of our presentation, I mentioned having a cylinder that was short filled, 1900 psi at 70 degrees, but we left the liters at 680 for an E. That was a misbranded product. We want to make sure that we have the proper amount of product in the vessel per the lot code. Using scales during and after fill, that's an FDA and DOT requirement. That is a requirement on the D55s that are filled in the plant for you to use as fill cylinders, as supply cylinders. Supply cylinder identification, that's found in 211-105. Sampling and testing of in-process materials and drug product. In-process checks. Why do we do in-process checks? When you are filling a liquid oxygen reservoir, you want to make sure that when you're looking at the reservoir itself, that it isn't generating frost spots. If it is, that means that it has lost its vacuum integrity. If it's lost its vacuum integrity, then it is going to build pressure too fast and the safeties will release. The consumer, the patient, will not get the full use. There's a time limitation on production. It's not applicable to nitrogen dewar fills. Liquid filling of nitrogen dewars, refer back to your delivery ticket for liquid nitrogen dewars. That gives you the step-by-step. This is just a couple of the nitrogen dewars you may or may not run across. If you notice, the top one has basically a floating cap. The one on the right, if you notice, also has a floating cap, but it also has vial holders. These are to hold specimens. Final production testing. Cryogenic nitrogen dewars, there's no analytical testing that we can perform on the dewar. This is on your route. It's filled from a properly qualified supply vessel. That's your D55. The dewar is labeled. It has to have a liquid nitrogen NF label on it. And it has to have a lot code on it. Every time you fill that vessel, you will be changing the lot code. Every time you fill the vessel, you'll be looking at the label to make sure that it has not become obliterated and it is fully legible, fully readable. Filling records. Our filling records for drivers are our delivery tickets. They're batch production and control records. It's a record prepared for each lot, like a home cryogenic vessel fill, for example, or a doer fill. If you remember back the delivery ticket for a liquid oxygen reservoir and a liquid nitrogen doer, it documents all the significant steps of production: your pre-fill, your fill, your post-fill inspections and tests as they are performed. It also has a dated signature, which is the filler and the analyst and or reviewer. Significant steps include the identity of the equipment used, the identity of all the components. Think of your liquid nitrogen delivery ticket. It asked, did it have a withdrawal device? And if it did, you would put a check mark, and if it did not, you would say NA, not applicable. In-process test results, that's the assay. Again, on nitrogen, you're just copying the results of the COA, the certificate of analysis, that is affixed to your supply vessel. Oxygen, on the other hand, must be analyzed. Documentation of the area inspections, you're documenting all the observations for that vessel. Does it have any big gouges, big dents? Is it contaminated? Is it clean? Samples of all labeling. Presently, there is no requirement from the Food and Drug Administration to affix a label to a delivery ticket or a fill log. We have those in our manual as masters. Description of the drug product container enclosure. Refer back to your nitrogen delivery ticket. If it had a withdrawal device, you would mark a check mark, and if it did not have one, you would say NA. And the identification of all persons engaged in manufacturing or performing those operations. If you have an assistant helping you on your route, and that person is helping you to do the inspections, their name as well as yours needs to go on that delivery ticket. Record review. Record reviews are accomplished by the QCU person. They will review your delivery tickets, even though they cannot physically see the delivery that you made. They're going by the documentation that you provided on that delivery ticket. It's done by a qualified person, not by a person performing the operations being reviewed. The reason for that is very simple. Typically, you do not want to fail your own work, so you might overlook something. A second set of eyes will make the corrections or have you make the corrections so that your paperwork is consistent and qualified. Investigate discrepancies or items not meeting spec. They must be corrected and documented. By that, we have an out-of-spec procedure. And if you are doing a liquid oxygen reservoir fill, and for some reason, when you do your assay, the assay falls below our guidelines, you must contact a QCU member for additional help. Our guidelines for liquid oxygen is 99.5 or greater. If you show something that is less than 99.5 or greater than 100.0, that is an out of spec. You must contact your QCU member and let your QCU member direct you in the next steps. There is a physical review of all containers for proper labeling. that is in the plant. It can't possibly be done en route, not unless you're lucky enough to have a QCU member with you in the case of training, for example. And a record review is conducted prior to distribution. Again, that can't happen if you're on the route making a delivery for a oxygen reservoir fill or a nitrogen dewar fill. That is done post-fill. Anything that is filled in the plant, whether it be nitrogen NF or liquid nitrogen, liquid oxygen, or oxygen USP high pressures, has to be conducted prior to the distribution of that product. The QCU member must review the production logs and the cylinders themselves to ensure that they are properly labeled, properly filled. It is acceptable to conduct by the end of the following business day the production record review. For example, if you're on the route and you don't get back off of the route until everybody in the plant has left, including the QCU member, the QCU member may review your records the next business day. Warehousing and distribution. Again, remember, your truck is an extension of the warehouse. So consequently, you and your truck fall under the same guidelines, the same rules and regulations as the plant that manufactures the high pressures and the liquids. There needs to be a quarantine area in the warehouse. That quarantine area serves a number of purposes. If you see cylinders in a quarantine area, you cannot take those out of there. Maybe they're quarantined for repair. Maybe they're quarantined because they have an issue with them, a bad valve, an odor, or maybe they are quarantined waiting for review and release. The storage conditions, temperature, humidity, and light, are not critical in the compressed medical gases and liquid medical gases. We may need to consider other environmental elements, such as, I believe I mentioned this earlier, such as the maintenance of the box trucks. If the box truck has a number of holes in the roof where oil, dirt, soot, snow, rain, anything can get in and contaminate the cylinders, that needs to be corrected. There are other issues with gases other than oxygen and nitrogen. Nitrous oxide, for example. Some manufacturers have gone to the extent, because nitrous oxide is an anesthetic, they have gone to the extent of establishing a fenced-in area within their warehouse where it is locked and only the person that is doing the actual production of nitrous oxide is allowed in that fenced-in area. If a driver needs 5 or 6 Ks of nitrous, 2 or 3 Es of nitrous, he needs to get a QCU person. If they are not doing the production, he needs to get a QCU person to allow him to enter into that fenced off area. It is not a requirement at this time. I'm just mentioning this is what some manufacturing facilities have gone to. It is not a requirement of the Food and Drug Administration at this time. Distribution of supplier-filled containers. What Hellgut Gas Products and Hellgut Gas Products customers should be doing. They should be doing the same thing that we would do. They should be inspecting the cylinders to make sure that they are labeled properly. They verify that the labeling is appropriate. They document the lot numbers of the cylinders received into inventory There's a documentation of lot numbers that are distributed. We do that on our delivery tickets. And does that supplier have a complaint and recall procedure if they are dealing with medical gases, be it liquid or be it gaseous? They have to have a complaint and recall procedure in place because these are medical drug products. They are drug gases. Our distribution records and distribution procedures. We want to go with the FIFO, which is the first in and first out. So as you are loading your vehicles, look for the oldest lot code gas first. Not the one that was just produced yesterday, but look towards the back of the pile and pull those cylinders out so there is a rotation of your stock. It's very simple because if we don't do that, we have a very difficult time as a company initiating a recall if there should ever happen to be a recall of that gaseous product or liquid. Recalls mean you have to come up with all of the cylinders that have been produced from that lot or from that batch. Remember, a lot is a portion of a batch. The batch is your bulk tank. It's the big 6,000 gallon oxygen or 9,000 gallon oxygen at the plant. It is also your supply vessel, your liquid oxygen D55 or liquid nitrogen D55. There is a traceability by using lot codes. Again, the lot code tells the entire history of manufacture of that drug product. It is traceable all the way back to the manufacture of the bulk product that we receive from our supplier. Distribution records includes shippers, delivery tickets, and bills of lading. The lot distribution records is the name of the product and a strength. The dosage form, which is our size of cylinder. The name and address of the consignee, and the date shipped, the quantity shipped, and the lot number. That is a requirement. Now, if you review your delivery tickets for your cylinder gases and your delivery tickets for your medical fills, whether they be nitrogen or oxygen, you will notice that it has the name of the product, which is oxygen USP or nitrogen NF. It has a dosage form, which is your size of your cylinder. It has a complete name and address of the consignee, the person that you're delivering it to. It has the date that it is supposed to be shipped. It has the quantity shipped. You will also have the quantity returned. Again, the lot number is a requirement. There are many, many more requirements in these two sections listed here, 205.5F and 205.50G, most of which do not require or do not apply to the compressed gas business. They apply to pharmaceuticals. In the morning when you are checking out your truck, you will be filling out a truck sheet. The truck sheet lists your different gases and the quantities that you delivered and the quantities that you returned. We have a specific procedure to be followed. This does a number of things because we are dealing with medical gases. We have a control. We know how many, say, E's of oxygen were on your truck when you left in the morning. We know how many were delivered. We know how many were returned. You know, how many you did not deliver. We know how many empties were returned. And a QCU person will check your truck out in the morning and check it back in the evening. This is the control of your drug product. It's very important that we control our drug product. Our delivery log is a very simple delivery log. Gives the customer the address and the order number. Now we have just recently instituted a new type of delivery log as well as a new type of truck sheet. So please refer to your new current truck sheets and delivery logs. If you have questions, please contact your QCU member and they can look up the answers, the policies, and the procedures on Dropbox and assist you in filling these out. Returned and salvaged drug products. Remember earlier I said that there is nothing that is being returned. You cannot return a drug product for credit. If you were to, there would have to be a number of procedures to identify it, to hold it, to retest each and every individual cylinder. Think of it in this way. It is much easier to call all the cylinders that are being returned, other than the full cylinders that you didn't deliver because they never left your control. But it's much easier to treat all the cylinders that were returned by customers as empty rather than sit there and try to assay each and every cylinder for identity, strength, and odor. It's just not practical. It is also not our practice. Some of the other records and procedures that we have, the general requirements for record retention. Record retention is extremely important because we have to be able to provide to an FDA inspector the current year plus the past 3 years of production. Now that includes delivery tickets, production logs, label logs, training logs, maintenance logs, among others. There is also a management communication where management will communicate to you and you are expected to communicate back to management if you see things that are not correct. It's a two-way street of communication. It's not the trickle-down theory. It's a two-way street of communication. Complaint files. I mentioned earlier about complaints. There is a written procedure for complaints, whether they be written or oral. You as a driver, you are the first person that they're probably going to talk to, unless they talk to a customer service representative. But you're the first person that they're going to say, gee whiz, this tank we received, it was only half full, or it was totally empty, or I can't get the cap off, or I can't open up the valve. Those are all legitimate complaints. You should have in your binder in your truck complaint forms. If you have a complaint from a customer, bring out your complaint form and start filling it out as far as you can go. You can't do the inspection, you can't do the investigation, but you can fill out all the other pertinent information. Pertinent information would be the product name, the lot number, the size of the cylinder, who's making the complaint, not just the company, ABC DME Company, but ABC DME Company Joe Smith. Because we may want to get back with Joe Smith and let him know what our findings are. Document the nature of the complaint. I can't get the cap off. I can't open up the valve. The label can't be read. The lot code is missing. Again, all critical complaints and valid. When you document your complaint, be sure you mark the cylinder that is the object of the complaint. It doesn't do any good to have one cylinder in a cart of 60 and you hand your QCU member your complaint form, and the QCU member is going to say, which cylinder is it? Oh, I don't know. Well, we can't hardly investigate 60 cylinders. So if your customer tells you that they have a cylinder that is suspect or they have a complaint about, make sure that the customer knows to mark that cylinder in some way so that it can be segregated, it can be quarantined, and it can be investigated. And finally, to assure ongoing Hellgate Gas Products compliance, what do you need to do? Well, you need to be trained. You need to be trained in the regulations, the procedures, and the specifics of your job. You need to understand the law and the regulations as they apply to you, and you need to understand the Hellgate Gas Products procedures. You need to make sure that the procedures work. If you are having an issue with a procedure, you do not understand it, you can't figure out how this pertains, speak with a member of management, speak with the QCU, and they will try to help you to understand. If you don't understand, then you're subject to taking shortcuts. And if you take shortcuts, then you're not being in compliance. And if you're not in compliance, then the drug product that you are manufacturing out on the road is adulterated. You need to follow the procedures as they are written. Until new procedures are put out, follow the procedures that are in your standard operation manual, standard operating procedures. You need to document your work properly. By documenting your work properly, what we mean is good penmanship. You have to be able to read what you're writing. But not only the good penmanship, but also do the process, document the process as you are doing the work. You can't sit in the cab of your truck and pre-fill a liquid oxygen reservoir fill or a liquid nitrogen dewar fill delivery ticket before you even get out of the truck and visually look at what you're trying to fill. Again, you're not following the procedures if you're doing that. You're taking a shortcut. And by taking that shortcut, you put yourself and the company at risk of being non-compliant. And because we are non-compliant, then the product that you just manufactured at the patient's home or at the DME plant is now adulterated. This is the end of the current good manufacturing practices section for the drivers. I hope that we are able to give you an insight as to some of the rules and the regulations. For additional help, get with your immediate supervisor, review the SOPs as they pertain to specifics of your job, understand them, ask questions if you don't. It only makes us all better. Thank you for your attention.